Module 2, Introduction to Trauma. In this session, we will look to introduce the concept of trauma, to explore the relationship between trauma and multiple and complex needs, to identify the impact of trauma, and to reflect on how we respond to people with multiple complex needs who may have experienced trauma. All of us will at some point in our lives experience challenging, stressful events that we might even describe as traumatic. It may be a redundancy, a relationship breakdown, a serious illness, or a bereavement. Anyone who has experienced one of these events can attest to how they have an impact on us, sometimes long after the events themselves, and often in ways we couldn't predict. Going through difficult experiences is an inescapable part of life for all of us, sooner or later. However, we also know that with good support from friends and family, our wider communities and other sources of help, we do find ways to get through and pick ourselves up. Unfortunately, we know that some people will experience traumatic events in their lives that go well beyond the typical challenges that we all face. And many people experience trauma in their childhood with devastating consequences throughout adulthood. A manual used for diagnosing mental health issues, the DSM-5, defines trauma as an experience of serious physical or psychological threat, a threat of death, serious injury or threat of serious injury, sexual violence, continued exposure to unsafe environments and experiences. Examples include childhood abuse, domestic violence, sexual assault, serious accident or injury, the impact of warfare. The essence of trauma is a serious threat to one's safety, often accompanied by fear, feeling trapped, and sometimes feeling shame. But we also need to keep in mind that what is traumatic is personal. Two people can have a similar experience but be affected by it differently. The long-term impact can be shaped by a whole range of factors, including whether or not someone had good support after the traumatic event, or whether it was recurring trauma such as abuse or neglect. You may have heard people use different terms to talk about trauma. These definitions are broadly agreed upon. Acute trauma, a single traumatic event. Complex trauma, exposure to varied and complex traumatic events, often of an evasive interpersonal nature. Post-traumatic stress disorder, often called PTSD, an anxiety disorder caused by a very stressful, frightening, or distressing event. Complex PTSD may be diagnosed in adults or children who have repeatedly experienced traumatic events such as violence, neglect, or abuse. When we are considering people with multiple and complex needs, it's typically the case that they have experienced complex trauma, and this may have persisted throughout their lives. For example, experiencing violence as a child and then experiencing abusive relationships in adulthood. They may not have a clinical diagnosis of complex PTSD, but nevertheless have been affected by complex trauma. An important study in America in the 1990s found that people who had had adverse childhood experiences, known as ACEs, were more likely to have had significant problems in adulthood. Adverse childhood experiences meant abuse, neglect, or challenges in the home, such as exposure to violence, substance misuse, and mental health problems. The more a child encountered these, the higher the chance of having chronic physical health problems, mental health issues, substance misuse, and risk-taking behaviours in adult life. More recently, some research in England found that 85% of people with multiple and complex needs or severe multiple disadvantage had experienced traumatic experiences in childhood. At a local level, a snapshot of the Fulfilling Lives South East caseload in 2017 revealed that all clients had experienced complex trauma, often starting in childhood and continuing throughout their lives. In light of this evidence, it is impossible to understand the challenges faced by people with multiple and complex needs and how best to support them without understanding the role that trauma may have played in their lives. Trauma can occur several ways, and it may not always be obvious to us. We can be directly harmed, for example, being physically, sexually, or emotionally abused. Witnessing harm to somebody else, for example, witnessing domestic violence between parents. Trauma can occur from living in a traumatic atmosphere, for example, a home with exposure to substance misuse, mental health issues, or other factors that make someone feel persistently unsafe. People can also experience traumatic events related to aspects of their identity, such as racism, sexual harassment, or persecution because of gender, sexual orientation, religious belief, or disability, as well as being stigmatized due to class, homelessness, lack of education, or mental health issues. Lastly, it is important to mention vicarious trauma. This can be described as the experience of trauma symptoms that can result from being repeatedly exposed to other people's trauma and their stories of traumatic events. This can happen amongst frontline workers like counsellors, support workers, police, and medical professionals who are regularly engaged empathetically with survivors of trauma. It is something that happens over time, and the cumulative effect can result in feelings of isolation, disconnection, depression, and what is often described as burnout. So, how does trauma affect us? So far, we've said that complex trauma is commonplace in the lives of people with multiple and complex needs. We've said that the more trauma that someone experiences, especially in childhood, the greater chance of difficulty in later life, such as substance misuse, mental health problems, offending, and homelessness. But why does trauma have such potentially devastating consequences? There is now a significant amount of research and evidence that helps us to understand the far-reaching impact of trauma. What we know is that trauma affects us at all levels: physical, emotional, mental, behavioural, and social. Trauma in the brain. Research into patients with a diagnosis of post-traumatic stress disorder has helped us to see that traumatic experiences can change the way our brains function. There is a part of our brain called the amygdala, which is understood to be the bit that helps us keep safe by telling our bodies whether something poses a threat. When we detect a threat, say a lion running towards us, the amygdala immediately springs to action and releases stress hormones around our bodies so that we can react quickly to protect ourselves. This is what's referred to as the fight, flight, or freeze phenomenon. We either respond by fighting off the threat, running away from it, or just freezing, unable to move. A byproduct of the brain's stress response is that other parts of the brain that are involved in memory and language are temporarily disrupted. This partly explains why people who have experienced traumatic events can't always remember clearly what happened or put their feelings into words. This system is meant to keep us safe, but the problem is that for people who experience trauma, especially complex, repeated trauma, the system starts to cause us harm. One leading expert puts it like this: ideally, our stress hormone system should provide a lightning fast response to threat, but then quickly return us to equilibrium. In PTSD patients, the stress hormone system fails at this balancing act. Fight, flight, freeze signals continue after the danger is over and do not return to normal. Instead, the continued secretion of stress hormones is expressed as agitation and panic, and in long term wreaks havoc with health. We will return to this in the next session when we discuss something called re-traumatization. For now, what we need to keep in mind is that for people with multiple and complex needs who have experienced a lot of trauma, they may be in a heightened state of stress, very easily tipped into a state of fight, flight, or freeze because of the long-lasting impact of trauma on their brain function. Trauma, mind, and emotions. It's important that we don't think of the impact of trauma purely in terms of a brain process. This can be helpful for understanding how trauma affects us, but is only part of the picture. Trauma can often result in people experiencing a whole range of debilitating feelings and mental health issues, including fear, anxiety, depression, feelings of self-harm and suicide, numbness and disassociation. People can have nightmares and flashbacks and feel as though they are right back at the traumatic event long after it's passed. Trauma can cause hypervigilance, that is being constantly alert to possible threats, and it can manifest as anger, sometimes explosive anger that seems to come out of nowhere. Lastly, trauma survivors may feel guilt and shame. It is not uncommon for a survivor of childhood abuse to feel confusion that they were in some way responsible for what happened to them. Any one of these could be deeply distressing, but people who have been traumatized may experience many different overwhelming and unbearable feelings and thoughts. And as these feelings disrupt day-to-day life, they can perpetuate further problems. Trauma and behaviour. It should be no surprise then that trauma also affects how people behave. Research by Shelter Scotland about street begging in Edinburgh found that 77.9% were misusing substances, 62.4% had physical health issues, and significantly, 80.6% had mental health issues. The report echoed some earlier findings into begging and rough sleeping, which stated that almost all of those interviewed had suffered severe trauma in their lives, including sexual, physical, mental, or emotional abuse, alcohol or drug misusing parents, the death of a parent, relationship breakdown, mental illness, and institutional living. The way people respond to trauma is not just limited to the issues such as substance misuse or offending. People who have experienced trauma may struggle with isolation, self-harm, and risk-taking behaviour. And one of the biggest challenges for people impacted by trauma is for them to feel safe and build trust in relationships, because oftentimes they have been seriously harmed by the very people they should have been able to trust in early life. This can impact on their ability to form friendships and relationships, to access employment, and to integrate into society. It can be easy to see people struggling with problems of substance use, homelessness, repeat offending, or other challenging behaviour, and attribute it to selfishness or some other kind of failing on the individual's part. In truth, many problematic behaviours develop as an understandable attempts to cope with the effects of trauma, including overwhelming memories, feelings of fear, shame, and anger. If we reflect on our own experiences, this picture starts to make sense. If we think about times when something stressful or upsetting has happened to us, how do we respond? It might be that after getting a parking ticket, we have to take a walk and let off some steam so we don't take our frustration out on a family member. Maybe after a hard week at work, we feel the need to switch off, go to the pub and drink more than we would normally, needing someone to help us get home afterwards. All of us adapt our behaviour in response to challenging experiences. This is what people who have been traumatised are doing, only the severity of the trauma may be met with self-destructive coping strategies that can make the problems worse. So what does this mean for us in our day-to-day work? If we work in client-facing roles, whether in housing, an advice centre, a doctor's surgery, or any service that provides support to people with multiple and complex needs, we can be certain that in many instances the people using the service will have experienced trauma, whether in childhood, adulthood, or both. Sometimes the way people present in services can be challenging. Someone may avoid contact or find it hard to say what they want and need. Other people may become explosively angry and it might not be obvious to us why. Other people may show up substance affected, distressed, or behaving unpredictably. It's not always easy to know how to best support people with complex needs, and we are going to explore this in more detail in the next session. But for the moment, there are some important things we need to keep in mind. Firstly, when someone presents in our service in a way that is challenging, we need to remember that they may well be reacting from a place of trauma. They may be on high alert because of the harm they have endured and are trying to protect themselves and cope with the situation and with feelings that they are struggling to manage. We don't always know what has happened to someone in the past, but it's important to try and remain empathetic and understanding. In many cases, we can't imagine what they might have been through. Secondly, we must remember that no two people have had exactly the same experiences and people will respond to trauma differently. We need to recognise the prevalence of trauma amongst people with multiple and complex needs and understand how it can affect people. But we need to also listen carefully and empathetically to individuals and not assume we know their story. To summarise the key message of the session, trauma is not just an event that took place sometime in the past. It is also the imprint left by that experience on mind, brain, and body. This imprint has ongoing consequences for how the human organism manages to survive in the present.
Okay, so my name is Martin McCallanan. I'm a current project consultant with the Fulfilling Lives project, and I'm a previous volunteer with the project as well. It's affected it massively. It's taken a really long time to kind of settle into a way of working with services and individuals alongside my trauma. To start with, it was a lot around trust and confidence. I really struggled to just basically communicate with services, to talk in general, let alone around the trauma and the confidence of actually attending. I really struggled just to get into the buildings a lot of the time. This is something I've really had to work on, especially my communication. I've managed to do this through volunteering. I've been very lucky to have volunteering opportunities to help kind of ease me into working closer with the services and organisations, but it's taken a long time. I think it was a good year of volunteering before I tried again to try and interact with some of the services and help that I needed. The main problem for me has been explaining myself when first interacting with the service. It can be really, really difficult to talk about trauma and just to be able to find the right words to communicate this with services, and often that leads to just not talking about it at all. It can be really difficult to find the words, and when there's no real environment or place for you to put it in a safe manner, you just don't at all. You tend to just step back. I think environment's one of the most important things. The environment can really play a huge, huge part. There was a lot of places I needed to be and people I needed to see that I didn't, simply because I felt that I couldn't go in. That I just felt either not listened to or quite removed from the staff and the people there, and then the physical environments as well. Job centres I struggled with quite a bit because they're all very, very uniform. So one experience in one, to move to another town and try to interact with that one, carried weight from the past environment, if that can make sense. The same with councils and GPs as well. They can be very, very similar in their setting and not very welcoming, which can make it really, really hard to kind of get in the door and to stay there. To try and schedule appointments around the clients and the service users if possible. Everybody has diaries, and sometimes our lives can be really, really chaotic. It can be really hard to find the time to even do the appointment or to keep one that's been set long in advance. So some form of flexibility around that I think is really important. And just to bear in mind that people coming into a service with trauma are inherently carrying a lot of weight, a lot of emotional weight, and that can really affect the way that they're going to interact with the service and the regularity that they're going to do that as well. To have an understanding of trauma, even just a basic understanding of what it is, I think that really helps your attitude going in and your understanding of how people are presenting to you and how they're kind of coming across. I think your attitude when dealing with people with trauma is really, really important. I found that the system services and even individuals that I worked with, the ones that I did was simply because of their approach, because they managed to help me manage my emotions and my engagement with them in a responsible way, and just to be really thoughtful about what I was coming in with. So I think attitude is really, really important. And I think it's really important to be clear about what's happening. One of the worst things for me, especially when dealing with a lot of essential services, was not knowing what was going to happen, going to the council and not really having like a plan of going forward, or going to the doctors and not knowing what was going to happen next. That was really, really hard for me. So just being really clear about what's happening and what is going to happen, even if that isn't really, really good, even if it isn't what they were looking for, just being really honest about what's happening in that moment. Just that it can be extremely difficult for people when first coming into services to let go of negative experiences of similar past services or organisations. So to be very clear about that this is completely, that you're not them, if that makes sense, because it can be really, really difficult when you're dealing with an organisation or a company or anything that has a name, because it carries weight with your past interactions.